The impact of a breast cancer diagnosis to a patient is enormous. There's the diagnosis of cancer, and then there is the incredibly traumatic thought of having to lose a breast.
When you know that you're facing this surgery, you're thinking about staying alive. You're not really thinking about the cosmetic piece and how is this going to look down the road. You feel like you're losing a piece of your femininity.
Jackie was diagnosed with breast cancer, and she was reacting not unlike any other patient, emotional, scared, had a lot of questions.
Dr. Serletti was part of the original surgical team, and we had long conversations about what to expect. How does this work? How does this proceed? How do they actually make this happen?
The most important things to know for a patient who has been diagnosed with breast cancer and is going to be treated with a mastectomy is that there are a variety of methods of breast reconstruction. The methods primarily are divided into two. One is implant-based, and the other is based on using the patient's own tissue. Penn Plastic Surgery has one of the largest comprehensive breast reconstruction programs in the country. And in terms of the most complex method of reconstruction, where we use the patient's own tissue and use microsurgical techniques, there's no other institution in the country that does more of these than we do. What the patient needs to do is get to a plastic surgeon who is familiar and performs both of these techniques, and then they can make a decision about what is their best option.
When I had the final reconstruction done, and even now when I get dressed, I feel really good about how I look, and there's no value you can put on that.
The physical component, I think, is something that a lot of folks don't think about, and that is, if a patient loses a breast from breast cancer and it's not reconstructed, it's very difficult to find clothes that fit properly. It's almost impossible to find a bathing suit that fits properly. Even in like playing tennis, moving the patient's chest, without a breast, it feels different. In providing a physical breast mound, they fit better in clothing, they feel more normal in clothing in a bathing suit, and it also has this very profound emotional effect.
Joe Serletti was marvelous, and he's given me back something really special. He's given me back my femininity.